Okay, today I will be what is peptic ulcer? This is the ulcer formation in the upper GIT that affects the lining of the stomach. What is GIT? GIT is gastrointestinal tract. So when there is an ulcer, what is ulcer? Ulcer is just like a wound, is a lesion at the stomach lining. You know our stomach. In the stomach, we have protection, things, both the mucosa, submucosa layers that protect our stomachs from dangers. So this peptic ulcer works in different ways. We have different types of peptic ulcer. One are the esophagus, which is the esophageal cancer. Sorry, esophageal ulcer. We have the one at the gastric side, which is referred to as gastric ulcer. We also have one around the duodenum, which is referred to as duodenal ulcer. We will specialize more on duodenal and gastric ulcer. Reason: esophageal ulcer is usually not rampant or is mild to treat when diagnosed earlier. You can just use salt water gargle and um hot warm water management to treat it and other mild medications. But in case of peptic ulcer and duodenal cancer, it can be complicated. In fact, it can it can cause a lot of discomfort if not met well, if not handled so well. What is the reason of this ulcer? Just like I said, that ulcer in fact impairs the abdominal integrity, the stomach, the integrity of the stomach. Those linings, those layers protecting the stomach are impaired. When something, when maybe an organism or something impairs those layers protecting the stomach, you will see that the acids there inside the stomach or the duodenum that is responsible for digestion will now form what we call autodigestion. They will start irritating directly the stomach and then causing injury, causing perforation. They can end up, in fact, it can end up causing a lot of complications. Might when they get inflamed, it can cause cancer. It can cause your food can no longer pass and pass to even after all the processes, even to the anus, there will be stump, and this is in fact it can cause a lot of other things. So this is the one. These are the how cancer can affect the body. Okay, but what are the causes of this ulcer? One of the causes of ulcer, one the major cause oh sorry one of the causes of ulcer disease is one what we call H. pylori. This is a bacteria. Full name is Helicobacteria. This is a bacteria that can be ingested through food, alcohol, drinks that are not sterile. So when you ingest them, the bacteria will travel through this oral route, and when they go to the stomach lining, they will start doing American wonders. They will start destroying the linings and causing injury. And you know, it's not just like the skin that can some of the injuries can easily go. This is internal injury. Eating food, the more you eat food, the more watery it becomes, the more acid is produced, and this can cause it can be hard to heal. It may take time to heal. So this H. pylori, when ingested, causes much harm. So you should be careful to prevent it. You should be careful on what you put in your mouth. Wash your hands. Make sure your fingers are cut. They are moderately cut. Wash whatever you want to eat. You make sure you wash it very well. Make sure it is not spoiled, because some of those spoiled foods have harmful bacteria inside, harmful Helicobacteria species that will cause peptic ulcer when ingested. Am I making myself clear? Yeah, okay. Um, what are other causes? Some people are habitual takers of non-steroidal anti-inflammatory drugs, such as ibuprofen. You see why? Oh God, I'm feeling pains. I'm feeling pains. I'm feeling. Oh, please go to chemist. Rush to the chemist. Tell them to give me some drugs for me, or ibuprofen, or one muscle, muscle relaxant, and you are taking it. They are taking it. At the end of the day, it will end up destroying your stomach lining, causing perforation, causing ulcer. We have a lot of causes. Some people that are habitual takers of alcohol can cause ulcer disease. Those people that they can't do without ingesting carbon monoxide inside your body, causing deterioration, causing, in fact, even not just ulcer, causing a lot of harm, damage to your body. So both smoking, alcohol, drinks, and most caffeinated drinks. Some people now they cannot do without taking lacasera. Okay, lacasera is out of date. What all these caffeinated drinks? What are these them? A lot of them bullets, others you are taking, you are ingesting, and they are busy damaging. And one of the major thing about all these things that they will not, the pain, the symptoms, signs and symptoms will not just, some of them doesn't come feel so fast. Most of them come after already damaging a lot of things. So with this, you can by now know the causes of peptic ulcer. What are the signs and symptoms? You will notice pain at your epigastric region, at the middle of your stomach, that it can radiate. Some will be vomiting food with blood. Some at a time you will notice that your stool is black. See, yes, your stool will be black as a result of bleeding, internal bleeding, which is a complication of peptic ulcer. Immediately you notice that your stool is usually black, and you are experiencing pain. You will notice that there is internal bleeding, that the peptic ulcer must be suspected. So we other signs and symptoms include, some of them, when if it's gastric ulcer, you will notice vomiting. You'll be vomiting blood, food mixed with blood, hematesis. This is the signs and symptoms of peptic ulcer. And we have a lot of others. So with this following points of mine, I know that you are already enlightened about peptic ulcer, and preventive is better than cure. We already have lots of medication that you can use to treat it depending on the type. Like we have antibiotics to treat it if it's a cause of bacteria, helicobacteria. Yes, you use antibiotics to manage it. We have antacids that minimizes the production of as HCl. So that is the the acid that causes irritation in the lining of the stomach. We also have histamine antagonist and pain relief medications for pain. So we manage all those things when it occurs. But it's, in fact, prevention is better than cure. It's better we prevent it by managing what we eat, making sure that we take medication by prescription, not just anytime you go to hospital, then you go to chemist, mix this one for me, mix pain for me, this. At the end of the day, you are causing harm to your body. So with the following point of mine, I know that I have given justice to ulcer, to peptic ulcer disease. If you have any question, just connect me to my comment section. Thank you very much for meeting me today. I remain my honorable student Miss Grace. Bye for now.